Hello, my name is Sushama, and today we're going to talk about Kopiker's unusual remedies and their hidden values. This is the book by Kopiker, Clinical Experiences, 70 Years in Homeopathy, and we will talk about the unusual remedies and what they can do. And I want to talk about one remedy that's been particularly useful to me because I have seen a similar person here around me in a similar sort of condition. This is my friend, my well-wisher and friend, Mr. Nadkarni, was my host in my early years here. So he's going to mention 6 cases, and I'm going to read one out of those 6 cases to you. So his friend and well-wisher, Mr. Nadkarni, is his host in his early years. We got news once that his father had been shifted 50 miles to Karwar District Headquarters Hospital in a serious condition, in a very serious condition. So Dr. Kopiker rushed up from where he was, reaching there the next evening. Back then, they visited patients, they actually saw them. It's hard to imagine doctoring done today the way it was done in the olden days. Yes, they covered less patients, but they managed to give them more personal care. This guy had a large prostate, complete obstruction of the urine. The civil surgeon frankly said he was too weak for any surgery operation. A rubber catheter had not gone, and the metal one injured the urethra, and bleeding took place. Ultimately, they managed to put a catheter to be kept in position with no idea when and how to remove it. I stayed there 2 days, then took the old man in a private taxi 100 miles to Dharwad, his brother's place, and started treatment. First, with the catheter in, I gave arnica 1 dose, next Thuya 200. He was always sensitive to tea, it made him giddy, and then put him on a remedy, thinking I was the first homeopath to use it in this condition. Can you guess what the remedy is? It was Digitalis 6C. It was given as the pulse was intermittent. In 1 day, we removed the bladder catheter. It was never used again. He was quite okay by Digitalis alone. Imagine my wonder and sense of awe when I read in Kent's Materia Medica a beautiful picture for the use of Digitalis in prostate enlargement. And I would invite you to look at Kent's Materia Medica, at Digitalis, and see what it does for the liver, for the prostate, urinary symptoms, retention of urine, and what small doses, meaning low potency doses of Digitalis will do for the patient. And I think today, when people are not able to, the elderly are not able to pee with prostate troubles, we're giving them blood pressure reducers. What do blood pressure reducers do? They're gonna reduce their blood pressure. They're giving them muscle relaxants, which will relax their muscles, all their muscles. They'll reduce all their blood pressure, and they're getting dizzy, depressed, in order to make the urine flow, but it's not addressing the underlying condition, which is probably heart related. And it's not looking at the root cause of the illness, which is in homeopathy addressed by Digitalis. So when you give these drugs that reduce blood pressure or relax the muscles, there's a very good, the heart is a muscle too, and if the heart cannot contract, you're going to increase the mortality of these patients. These drugs don't work for anywhere from 1 to 6 months anyhow, and if they do, they may or they may not. And so really, the patient is going to die from the drug, not from the disease. Today, when the catheters are inserted or the patient goes to hospital, there's great danger of MRSA, there's a great danger of sepsis in the body, And so there's a whole host of problems created that are harsh on the elderly patient, that are not gentle, they're not effective, that are not curative, and that don't address the fundamental problem. This guy recovered from a dose of Digitalis 6C. So I would invite you to read about Digitalis in the Materia Medica, read about the repertory rubrics of Digitalis, and make your judgment on that particular remedy by reading about it. Thanks and have a great day.